Have you ever wondered how doctors seem to know exactly when your baby is due? Or maybe you've already missed your period and you're asking yourself, when will my baby arrive? Well, the truth is, calculating your due date isn't as mysterious as it seems. In this video, I'm going to walk you through the different ways to estimate your pregnancy due date. Using Naegele's rule, the conception date, IVF day, HCG test results, and even ultrasound dating scans that estimate the due date based on your baby's growth. But here's something important to remember before we dive in. Your due date is an estimate, not an expiration date. Babies come on their own perfect schedule, and no calculation can predict the exact day your little one will arrive. So grab your notebook, and let's break it all down clearly, step by step. Let's start with the most common method used worldwide, Naegele's rule. This rule assumes you have a regular 28-day menstrual cycle, which means ovulation usually happens around day 14. To calculate your due date using Naegele's rule, you take the first day of your last menstrual period, LMP, add 1 year, subtract 3 months, and then add 7 days. For example, if your last period started on April 10, 2025, you add 1 year, April 10, 2026. Then subtract 3 months right pointing arrow January 10, 2026. And finally add 7 days right pointing arrow January 17, 2026. That's your estimated due date. Simple, right? But remember, this method works best only if your cycle is exactly 28 days long and your ovulation happens on day 14. If your cycle is longer or shorter, the result might be slightly off. Now, let's talk about another method. Calculating your due date using your conception date. This one is a bit more specific. Conception usually occurs about 2 weeks after your last period in a 28-day cycle. So, if you know the day you ovulated or the day you had unprotected intercourse that led to conception, you can simply add 266 days, or about 38 weeks, to that date to estimate your due date. For example, if you conceived on May 1st, adding 266 days gives you January 22nd as your estimated due date. This method is useful for women who track their ovulation, or use fertility apps and know their conception day precisely. However, most people don't know the exact day conception occurred, so this is often an educated guess rather than a confirmed date. Next, for women who conceive through IVF, in vitro fertilization, the calculation is much more accurate. When you undergo IVF, the doctor knows exactly when the embryo was transferred into your uterus, depending on whether it was a fresh transfer, 3 or 5 days after fertilization, or a frozen transfer. Your due date is calculated by adding 266 days, 38 weeks, from the date of fertilization or by using specialized IVF due date calculators. For example, if your embryo transfer was on July 5th, and it was a 5-day embryo, your conception date is considered June 30th, and your due date will be around March 23rd the following year. IVF due dates are often the most accurate because the timing of conception is known exactly. Let's move on to another method, calculating using HCG test results. The HCG hormone, human chorionic gonadotropin, is the hormone detected by pregnancy tests. It starts rising soon after the fertilized egg implants into your uterus. While HCG levels can confirm pregnancy and help estimate how far along you might be, they're not accurate for calculating the exact due date on their own. Doctors can use a series of HCG measurements taken a few days apart to estimate gestational age, but this method is less reliable compared to others like ultrasound or known conception dates. It's more of a supportive tool rather than a main calculation method. Now, let's talk about one of the most scientifically accurate methods, the dating ultrasound scan. During your first trimester, usually between 6 to 12 weeks, doctors perform an ultrasound to measure your baby's crown rump length, CRL. That's the distance from the top of the baby's head to the bottom of the spine. The earlier this scan is done, the more accurate it is in estimating your due date. Why? Because all babies grow at roughly the same rate in the early weeks. So, if your baby measures, say, 10 weeks 3 days during the scan, the machine will estimate your due date based on that measurement, counting forward to 40 weeks. If your due date from the scan differs by more than a week from your LMP-based date, your doctor may adjust your due date according to the scan. That's because the baby's size is a more reliable indicator than period dates, especially if your cycles are irregular. Now, I know many women ask this next question. Can I estimate my due date even before getting pregnant? The answer is yes, but it's just a guess. There are due date calculators where you enter your expected ovulation or conception date, and it gives you a projected due date. However, since conception depends on ovulation, sperm lifespan, and implantation timing, you can't guarantee accuracy before pregnancy. Think of it like predicting the weather 2 months in advance. It gives you an idea, but things can change. If you try and it aligns perfectly, that's great, but if it doesn't, that's completely okay too, because every baby comes according to their own divine schedule, not a calculator's. Now, here's a key point many people overlook. Your due date is just an estimation. Pregnancy is considered full term between 37 and 42 weeks. That means your baby can come anytime within that 5-week window and still be completely healthy. In fact, only about 4% of women deliver exactly on their due date. The rest give birth either a bit earlier or later. So, don't panic if your baby doesn't arrive on time. The due date is there to help your doctor plan checkups, track growth, and monitor your baby's development, not to schedule your life around it. Let's summarize everything we've learned so far. Naegele's rule: add 1 year, subtract 3 months, add 7 days to your LMP, for 28-day cycles. Conception date: add 266 days to the day you conceived. IVF calculation: add 266 days from fertilization or use embryo transfer date. HCG levels can suggest how far along you are but not the exact date. Dating scan measures your baby to estimate a more accurate due date. Before pregnancy, you can estimate, but it's not guaranteed. And remember, your baby's timing is unique. Whether early, on time, or a bit late, every journey is special and perfect in its own way. Before we wrap up, I want to leave you with this thought. Pregnancy is not a mathematical equation, it's a miracle. While science helps us understand and prepare, your baby chooses the moment to arrive. So, stay calm, stay healthy, and trust the process. If you found this video helpful, don't forget to like, comment, and share this video with other expecting moms or anyone curious about pregnancy. And if you haven't already, subscribe to my channel and turn on the notification bell so you don't miss out on more informative videos about women's health, pregnancy, and wellness. Let's continue learning together, one fact at a time, 1 week at a time. Thank you so much for watching, and I'll see you in the next video.